A warning tonight about one of the most popular drugs of choice for teenagers, but this time it's not coming from doctors, police officers, or other adults. It's from a teenager. A few months ago, 17-year-old Taylor Snider tried Molly, a form of ecstasy. What happened next changed her life forever, and she wants other young people to know about her terrifying close call.
Taylor Snider was in and out of a coma after taking just one pill of what she believes was Molly, a street name for MDMA or ecstasy.
So after I took that pill, I started throwing up all night. And then in the morning, I had a seizure.
Okay. It's rolling. Rolling on beat.
How can we have audio speed, please?
So I'm just gonna slate here, in frame, and we're good to go.
A couple friends and I were planning on going to a music festival one weekend, so we thought we'd try this drug and kind of see what it was like. None of us had ever done it before. So yeah, we all took one capsule. The adverse effect was that I eventually lost consciousness, started seizing, and then ended up in the ICU for 5 days.
My name's Lisa Snider. I'm one of the nurses at Peace Arch Emerge. I was actually at work that day and got a call from my son at 10 a.m. and said that he was picking up his sister from a sleepover. And when I came home, she was unresponsive on the couch and not able to follow direction. Obviously, we called the ambulance. She was brought into Peace Arch Emerge and within several hours was admitted to the ICU at Peace Arch Hospital. It was terrifying. All your medical expertise goes out the window. You're a mom and it's your daughter. Will she wake up? If she does, what will her mental capacity be? What will her limitations be? No one could really give those answers. And yeah, it was a tough time. Peace Arch is a small hospital. We're like family there, the staff. I felt safe there. I knew Taylor was getting the best care that she could get. I'm extremely grateful to the staff, the doctors, everybody at Peace Arch Hospital, the ICU. I don't think the outcome would have been as good as it was if we didn't have the ICU at Peace Arch.
I'm lucky enough that I actually did wake up, so I should probably do something with that experience and share it to people and just tell them about it. Whoa, like I have to do something about this and just try and prevent that from happening to anybody else.
So now I'm actually a licensed practical nurse, and I think the whole experience of me being in the ICU at Peace Arch, it definitely gave me insight as to what kind of goes on behind the scenes taking care of someone in a critical care setting. My mom's also a nurse in emergency at Peace Arch Hospital, so she's always inspired me too.
A hospital in a small community, we're all actually a part of it. And I think it's important to help support and to give to that community hospital if we can.
Truly, you never know when it'll be you or your family requiring that critical care, just like me.
So in April of this last year, I guess it was now, I'm a type 1 diabetic and I was diagnosed very late in life and I've had real trouble with my sugars and my pump decided that it was not going to exactly work properly. It looked like I was having diabetic ketoacidosis. You feel like you're wearing lead boots on your feet. You can't make your legs work. You can't make your brain work. Your brain actually starts to shut down to protect the rest of your organs. It's very scary. I felt like I may not actually be coming back from this one. I just could not get my sugars down. It didn't matter what I did. And so I called my husband and he came and took me to Peace Arch Hospital. And then within a couple of hours, I was admitted to ICU. The doctors there were really understanding and helped me walk through kind of what the situation was with the pump. The staff at Peace Arch Hospital have always been absolutely incredible. The space reminds me of a very, very small closet as far as the room that you get is concerned, and it's not even a room, it actually has curtains around it. So there's not a lot of privacy as well, and there are patients right next to you. But, I was just grateful that I was being looked after. My total experience at the ICU is one of thankfulness and gratitude, because without them, I wouldn't still be here.
So the intensive care unit is a critical component of any hospital, supporting the needs of patients that are the sickest. How the ICU looks doesn't look much different than when I started back in 2005. So it's an old unit. It's very outdated. It's very cramped. It's even extremely difficult to move beds in between the different care areas. So equipment ends up in every nook and cranny, to the point that even when we're trying to locate our medications, we have a lot of trouble getting to them sometimes. Because we deal with critically ill patients in the ICU, people do pass away. And in our present environment, they're in a very small space, separated by curtains between patients. And so when people are experiencing their last few moments of life, the dignity for them, as well as the family, isn't really there. It's not ideal, right? We want them to have a bigger space, a more private space in which they can say their final goodbyes.
So my name is Romi Gill. I had woken my wife up when I found it extremely difficult to breathe during the holiday season of 2018. We did rush over quite a bit because my breathing was getting much worse through the drive. And after a few tests and being in Emerge, they had decided to then admit me to the telemetry unit based on the symptoms that I was showing. I was a fairly fit 28-year-old at the time. I was playing sports, and you never really think that anything like a heart attack could happen. They only happen to people who are, older. I think the nurse was also taken aback because the reaction was a little frightening when it was stated that I was having an active heart attack about 4 hours after being admitted to the hospital. And then when they did the x-ray, that's when they called all the doctors back to the hospital and back into the room. There was a bit of concern because he did close the drapes around us and had a look in his eyes of genuine concern. And he had notified me that they found a substantially sized tumor in my lungs and in my mediastinum, and that scared the crap out of me. My main concern was, am I gonna have turkey dinner with my family tonight? And he said, probably not. You're probably gonna be here for a bit. And I just felt like I let my family down a lot at that time. And it was tough to process. I was a little concerned seeing that a lot of the rooms were shared. I was concerned about my privacy, how many people I wanted to know what was happening with me. We did end up calling Peace Arch home for about a month of waiting to find out what was wrong with me. It was a very long month, so we did celebrate New Year's with the staff. Once we did the biopsy, a lot of blood work every morning, it was determined that I had stage 4 non-Hodgkin's lymphoma. It was, in fact, cancer that they had found in my body. Going through that process and seeing where I'm at today, I'm never going to forget Peace Arch Hospital. There was some extremely memorable bonds that I made while I was on the 4th floor. You'd meet someone on Monday and they'd become your best friend by Wednesday when you do your morning walk around and say hi to everybody. And the staff were so supportive, and we continuously talked about how we can give back to Peace Arch just because it meant so much to us. I know everybody always talked about you need to go to the big hospitals for the best care. We were opposed to that notion. We were happy with what we were getting at Peace Arch. When I look at that month that we were there for, it's always gonna have a place in my heart. Every time I pull into the parking lot at Peace Arch, I look up to the 4th floor and say, there's a window I gazed out of every single day. The care and the support was phenomenal, but the resources are heavily strained, and it was noticeable to me during my time there. Seeing shared rooms of 4 was extremely difficult. Seeing many ICU patients overnight airlifted in and immediately having to be airlifted out because the resources aren't there to care for every patient.
I would say we need an ICU because it's our ICU, it's our community's ICU. Our patients and our family members in our community will be treated in our ICU, so I think our community deserves to have the best ICU that we can have.
It's important.
I truly believe it's a gift.
It's something that is absolutely needed today.
It's something that can actually have an impact on someone's life, like it did on me.
Every donation will help us do our job better.
Okay. So you guys are good? Yeah. Okay. Yes, of course. Thank you. I'm sorry.
Thanks a lot.